And there's a fascinating study which showed that they took off an office. Half the workers had a cold shower every morning, half the workers didn't. And the ones that had a cold shower...
What do you think about the face plunging?
Putting your face in iced water is a parasympathetic effect.
Okay.
So this is the rest and digest system. It slows everything down. Your heart rate goes down. Your blood pressure goes down. And the great thing about the parasympathetic stimulation...
Is this something that's like, brand new? All of a sudden, we've got this idea for cold therapy, because somebody one day, Wim Hof, maybe, got in the water and was like, this feels great, we should all do this. Or is there actual, history behind doing these kind of cold therapies and the benefits for the body and the brain?
Minimize discomfort, maximize fun.
All right, Mark, welcome to the Invigor Medical Podcast. We are so excited to have you.
Thank you. I'm so delighted to be here.
Oh, good. I'm thrilled too. I really am truly very thrilled. And for anyone that's a regular listener, they're probably wondering my co-host Derek Berkey is. He couldn't be here today. And he asked me, Nat, do you think you can handle this on your own today? And I was like, say less. I have been so excited to have you on as a guest talking about cold water therapy. It's something that I've been into for years, back before it was like really cool to be into, and anytime I posted about it, people just thought I was absolutely bonkers crazy. So I I was telling you before we started recording, usually there's just like questions and outlines on the iPad that are made up for me that I reference, and I have a full page of notes in my phone with questions for today. So suffice it to say, I'm ready for today, and I'm so thrilled to have you with us. And you're coming to us from Norway, right?
Yeah. So I work here half of the year and swim here half of the year.
I love it.
Which can get pretty cold.
I can imagine. What's the water temp like there, like in the coldest months?
Oh, in the coldest months. But the thing is, we have, at the moment, actually, it's got quite nice and warm. Where I usually swim, 16 centigrade. So, that's quite comfortable, maybe 60.
Nice.
But in the winter, you probably have 4 or 5 months where you're sort of under 5 degrees centigrade. So sort of 40 or less.
That's pretty chilly. That's pretty chilly.
I have actually once been into the sea when it was below freezing point.
Whoa. And so you just might have a little ice on top of that water you have to break through. And I think
it's quite funny. The Norwegians got this word for the skin on the top of a milk.
Yes.
Which is, you get that. They've got a word called snack for that.
Snack.
And that snack.
Okay.
And you get that on the sea. When the sea gets to about freezing point, you get this kind of layer of jelly on the top.
Oh, interesting.
And that's so before it properly freezes. And that's what they call that little layer of jelly on the top. And there was that there when I swam that day.
Okay, before we get into things, and I feel like I'm going to be so scattered on all of my thoughts, but let's start where we should start, which is a little bit about you and your background, right? Because I think one thing that we're intentional about at Invigor Medical is making sure that we bring on professionals to speak to certain topics versus just somebody that did something one time and maybe did a little research and now they have lots of ideas on a topic. So I'd love to know a little bit about your background and how you got here, and then maybe what's the personal story that led you into cold swimming or cold water therapy?
Yeah, they're all kind of linked, really. So on one level, it's just the fact I swim, always swum. That's how I keep fit. Always. I wasn't a particularly good competitive swimmer growing up, but I kept going, and I still swim in the pool, 2 or 3 times a week, train properly. But I never, even one summer, summers I used to lifeguard on the beach on the south coast of the UK, and I never really went in the sea. But then one summer, I moved back to Brighton when I became a consultant anaesthetist. So that's kind of like an attending, I think,
okay,
is the American term.
Anesthetist? Is that what you said?
Yeah, and then I suppose it would be an attending anesthesiologist.
Okay.
How you say it. So medically qualified person who gives anesthetics.
Gotcha.
And so I sort of moved back to Brighton and kept swimming with my old swimming club. And one summer, the pool shut for a couple of weeks in the summer.
Okay.
And, I was just complaining to a friend of mine, old friend of mine. I said, I can't swim for the next 2 weeks. I said, go and join the sea swimming lot. And I didn't even realise our club had a sea swimming group.
Oh, funny.
And I thought, and I was surprised anyone else when I realised they swam all year round. But
Right, you're not
anyway,
expecting
I
that.
sort of went in, just expecting to swim for a couple of weeks while the pool was shut. But I still remember that first time when I got out, I just felt so good. I really wasn't expecting that
Yeah.
at all. And so that 2 weeks has become over 20 years now. I've been doing it, and it's become research, a book, and all
Right.
that kind of stuff.
Right, because you've written a
But
book now as well.
yeah,
Yeah.
but on the other hand, so that was one thing. So I got into cold water swimming,
Okay.
but kind of at the same time, my main research and what is the basis of my PhD was actually around stopping people getting cold.
Oh,
Uh,
interesting.
so if you have an operation,
Uh-huh.
you have a stress response to this operation.
Okay.
And the greater the stress response, the more complications you get.
That makes
One of the
sense.
ways we can reduce that stress response is stopping you from getting or becoming hypothermic. And this is
Okay.
actually quite an interesting point about cold water swimming generally, is it's that exposure to cold which is good for you, but becoming hypothermic, so your core temperature goes below normal,
Right.
is always bad for you.
Okay.
So anyway, so I was researching this topic of hypothermia, how to stop it, all the things we can do to warm people, to measure temperatures and things
Mm-hmm.
like this. And I started coming across articles about cold water adaptation. So
Hmm.
this is where you go into the water a number of times and your stress response adapts. And the
Right.
way it adapts is it reduces that stress response. And we don't want to get rid of that stress response because that's an
That's not good either.
evolutionary thing which
Right.
you can have sort of pathological levels, too much of a good thing, basically.
Right.
You want to stay in the good zone rather than go in the too much zone.
Mm-hmm.
So I started reading about this, and the way the body adapts to that stress response is exactly kind of what we're trying to do as anesthesiologists to reduce the stress response to a level which is good for the body rather than that which is too much for the body.
And is
I
that
thought
what's happening
that's
when
an
you're like in surgery and under anesthesia? Like your body's getting cold, and so you're trying to keep it from getting too cold? Is that part of it?
Yeah, that's part of it. So what happens is, although you don't remember anything, although you don't feel anything,
Mm-hmm.
what is happening is your body is still reacting as if it's being cut into by a knife,
Because it is.
which it is,
Right.
you know.
Just because you don't have a conscious awareness of it, your body has its own intelligence, right?
Exactly. Yeah,
Yeah.
your body still feels that effect. You're only affecting the brain with this.
Mm-hmm.
So you're having this massive stress response, and and it's too much for the body, really. It causes complications. The greater that stress response, in very broad terms, the more complications you get from the surgery, and maybe
Right.
the longer your recovery is.
Right.
And one of the things that exacerbates this response, this stress response, is getting cold. But there are
Okay.
also a number of other factors. It's just that, the body just reacts. And if
Mm-hmm.
you can reduce that reaction to the being cut into by a knife,
Right.
then you can reduce the number of complications. And so the way the body adapts to cold is exactly what we want for reducing complications. For example, your levels of insulin resistance go down. So basically, your body insulin, a massively important hormone in the body, not just with
Right.
sugar levels, but with all other kinds of things. And insulin resistance, so when the body's not so sensitive to insulin, is actually an independent marker of complications following surgery. But we
Wow.
know if you adapt to the cold, your insulin resistance goes down. So you're
Hmm.
more sensitive to the insulin. So that in itself makes you think, well, it might reduce complications overall. So my first theory and the first paper I published on this it was in medical hypotheses. So it's still not a clinical reality,
Of
let's say.
course.
But that was about using cold water swimming and theoretically why cold water swimming could reduce complications to surgery if you adapted before you had your operation. But then after that, what happened was one day I was just in the pub after work reading the newspaper, and I came across an article which said that that depression is associated with inflammation. And it turns out about 60% of depression is associated with inflammation.
Wow.
And I knew from my reading that one of the effects of cold water adaptation was a reduction in inflammation.
Mm-hmm.
And I knew how good I felt when I swam without being depressed.
Right.
I thought, well, maybe we could use cold water swimming as a treatment for depression. And so what we did after that is we set up this thing called Chill UK, where we take people out into the cold water and give them a course in water safety and feeling confident with the water and having a lot of fun.
Mm-hmm.
And with those people, we looked at treating anxiety and depression. We have really good effects from that. Since then, we've done a feasibility randomized controlled trial. And now we're actually in the process of recruiting. I think our first course starts at the end of this week to a full-scale randomized controlled trial called Outside 2, which pitches cold water adaptation or cold water swimming against normal treatment for depression.
That is so exciting to hear. I cannot, like, things like that. Any kind of alternative treatment outside of pharmaceuticals is something that really excites me. Because I think that we're just so stuck in treating symptoms and not getting at the root cause of things and keeping people sick instead of equipping them to be healthy. And just the rise that we see in depression and anxiety, in our society over the last, 10, 15, 20, 50 years is just staggering. And I know part of it is awareness and diagnosing. Obviously, that's part of it. But it's just too high to not also correlate it to the fact that we're just not healthy anymore, and we're not incredibly equipped to be healthy, and we're often stuck in this cycle of diagnosis, medication, diagnosis, more medication, side effects of medication, or and not actually getting healthy. And not even to talk about, it's a whole nother conversation about our food and the lack of nutrition we have there and how many additives are in it. But as you're talking, there's so many different directions I want to go. But the first thing I want to start with is you say cold water swimming a lot. I say cold plunging. People talk about cold showers. There's also some who just do face ice baths, right? Because of the AVAs in the face. And some people say that it's just as effective as a cold plunge. So I'd be curious what you have to say about that. But first of all, can we just differentiate if necessary? Is it that moving in the cold water is paramount, and then if all you have is like your ice bath in the backyard, that's also still good, and then maybe it's the cold shower, or is it all good, just do any of it? Like, can you speak to that a little bit?
Broad message is it's all good.
Okay.
Exercise is good for us.
Right.
So if you do cold swimming, if you do swimming as part of the cold, that's going to be a bit better for you.
Better. That makes sense.
However, I don't think that has the major effect.
It's the cold.
I think you're getting most of the effect is getting into cold water, and you're exposing yourself to the cold. Now, this is maximum. You get the maximum response to this probably somewhere between 10 and 15 degrees centigrade. So, that's not really that cold. What's that? 50 to 60 Fahrenheit, maybe?
Right. No, it's really not that cold.
There are two things which affect the response to the cold, this exposure to the cold. One is the absolute temperature, and two is the rate of cooling.
Okay.
So the absolute temperature below 10, you probably don't see any more effect on the physiological response. I mean, even at 20, so 68 Fahrenheit, you get all your blood vessels close up when you go into cold water, vasoconstriction.
Okay.
You get maximal vasoconstriction at 68 Fahrenheit.
Wow.
So you're getting a strong physiological effect at anything 68 degrees or below.
Okay.
So that's one thing. So it doesn't have to be that cold. So ice baths aren't that necessary, or they aren't necessary. Cold showers is an interesting one. The thing about them is you don't cool as quickly,
right,
because you're not totally immersing yourself. So a cold bath would be more effective. But also the temperature of a cold shower likely to be around 68, 70. That's just what we have in our water tanks.
Unless it's the wintertime. I know my cold showers in the wintertime are way more effective than in the summer. In the summertime, I'm like, this just feels refreshing. In the wintertime, I'm like, I don't want to be in here.
Yeah, so so basically, it's not like to be as cold, and it doesn't cool you as quickly. But
Right.
they do have an effect. I mean, there's a fascinating study which showed that that took off an office. Half the workers had a cold shower every morning, half the workers didn't, and the ones that had a cold shower had less sick days. So
Wow.
it does have a measurable effect.
Hmm.
However, it's unlikely to be as much as
Right.
the getting totally immersing yourself in cold water.
Right. Well, and that makes sense to me, and I think it's nice to be able to have that option because not everybody has access to an ocean that's chilly that they can swim in, right? And we have rivers here in Southeast Washington, but even from where I live, it's gonna unless I kind of want to go to the smaller, very rocky river, hard to submerge myself in. Not as much access, and then of course in the summer. It's probably, to me, it doesn't feel as cold because I've got that cold adaptation. But to other people, they're like, this is so cold. I don't want to be in here. So to know that showers is something that you can utilize and it's still beneficial, there can be benefits. And I mean, honestly, that's where I started. I can't even remember where I first heard this. It was 2018. I was coming out of the fog of a divorce, trying to be healthy, trying to get mentally well. And I saw something somewhere, can't even remember what, about cold water therapy. And I was just kind of like, I want to do something. And this is something that I can do that's easy. Ish, accessibly easy, right? I don't have to go anywhere to do this. It's not a medication. It doesn't cost me anything except effort. And so I started doing it, and it was intense at first. But as I adapted to it and started getting into the winter months, then also when we got snow, I would go out and lay in the snow, like a couple minutes on one side, couple minutes on the other side. Learned it was important to put gloves on after the first time when I couldn't feel a finger for a few hours after that one. So pro tip, put on gloves. And then it was shortly after that I finally did my first plunge in the river here in Southeast Washington in the wintertime. But I love knowing that the shower is still beneficial. What do you think about the face plunging? Because that's something else for me, like especially in the summertime when I don't feel as much of a kick of the effect of a cold shower because the water itself is warmer. Having a bowl of ice water to plunge my face in for as long as I can, take breaths and keep going, I do notice a big effect from that. So like, is that something that you've played with or done any research on?
Yeah. So just to go back quickly, I
Sure.
would say you say pro tip: gloves, shoes, also a hat.
Uh-huh.
I like to have a swimming hat, but
Uh-huh.
something in the head. These are all good. They do not reduce the effect of your cold plunge in any way at all, and they
Okay.
make it much more pleasant. And if
Mm-hmm.
you're on something like in the river, for example,
Mm-hmm.
they are really good. Yeah, the shoes are great to give you that stability and things like that. So
Yeah, I need to
use
get some
them.
shoes.
Top
Usually
pro tip.
I don't swim in the water. To me, it enhances the how painful it can be. But so I get in there and I keep my hands above the water like this in prayer. And I actually like do meditation. I like focus on my breathing, keep my hands out. It's like right here on my chest. I'm like up to my chin, And so that's what I do so that I don't get my fingers in. But having something to protect my toes would be smart, especially coming out of the river on the rocks. It is sensitive when I'm stepping on those rocks and my feet are really cold. So I'm going to have to find some shoes that are going to help with
Yeah,
that better.
and they make such a
I
difference.
can
You
imagine.
get some great shoes where you can walk all the way down. I've got shoes where I can cycle in, but they're
Mm-hmm.
really light and they drain. They're kayak shoes. But anyway, to go back to your question
Mm-hmm.
on ice on the face.
Mm-hmm.
Now, I think this is a bigger physiological thing, actually. So
Mm-hmm.
when you go into cold water, when you put your body, the rest of your whole body in cold water, you get a sympathetic response. So you get
Okay.
that fight flight
Right.
response.
Right.
It's a stress response.
Mm-hmm.
Simple as that.
Mm-hmm.
What regular cold plunging does is it attenuates that response, so your blood pressure doesn't go up as much, your heart rate doesn't go up as much, you don't secrete as much adrenaline, noradrenaline.
Okay.
Okay, so that's a sort of a long-term effect. That cold plunging body is a long-term effect. Now, with the face is different because that is putting your face in iced water as a parasympathetic effect.
Okay.
So this is the rest and digest system. It slows everything down. Your heart rate goes down, your blood pressure goes down. And the great thing about the parasympathetic stimulation is it has a direct anti-inflammatory effect.
Oh, really?
So that is doing exactly what we want. So you're getting an extra layer out of that. So some people won't put their face in the water, and that's fine. You're still going to get a really good effect from the cold adaptation. But if you want an immediate hit of cold water goodness, putting your face in
Yeah.
is effective. Talking of research. I mean, there's a bit of research about that. Actually, I mean, there's a lot of really interesting stuff like vagal stimulation.
Oh,
They
yeah.
actually put electrodes into the vagal nerve,
Okay.
which is the basis of the parasympathetic
Right.
nervous system. So if you stimulate the vagus nerve, you stimulate the parasympathetic nervous system, and you have this anti-inflammatory effect. But they're actually using that now for resistant depression. Don't need it. You stimulate it by putting your face
Wow.
in the cold water. But I think more fun and a better illustration is I've run these courses for teenagers. And what I do is I run a half day for them, and we do a bit of the physiology and we do some experiments. And one of the experiments is to put your hand in the ice cold water and measure what happens to the pulse. It goes up, it's painful. And I was surprised when this actually worked, but it really does work. Then you get them to put their face in the cold water, in the ice water, and you actually see after a little delay, a few seconds delay, their pulse goes down. And you'd have thought, actually, that wouldn't be the case, because it is still painful
And because you're holding your breath.
but it shows how strong an effect it has on the
Wow.
parasympathetic nervous system, which, as I say, that will have an anti-inflammatory effect, which is what we're looking for both depression and for a whole range of other
So many things.
lifestyle-related illnesses.
So many things are rooted in inflammation. I mean, we just had a specialist on last week who's an autoimmune disorder doctor. I mean, he's incredibly at the forefront of his field, the research that he's doing. And, we had a whole segment on the podcast that was talking about inflammation and how it's connected to all of these things and, chronic inflammation, seeing it in things. So that was one of the things that first stuck out to me about cold therapy. And I do want to do one more differentiation. So we're talking about cold water swimming versus plunging versus showers versus this. What about cryotherapy, right? Because that was also something that started to come in the rise, these, cryo chambers you get in and it can get this cold, like minus this many degrees, which is interesting because there's a point where I'm like, okay, is cold, like once we reach a certain temperature, is colder really better? So is it just like cool to be like, I went in at negative 45, And I did it one time. Granted, I'd already been doing cold water therapy for a couple of years. And I didn't really like it as well. I didn't love the feeling of the cold air on my head the whole time. Like at least when I'm in the river, I can choose to put my head in for periods of time. And obviously it wasn't, the cold wasn't as, I don't know, all encompassing is what I would say. And it took me longer to get cold. And it's almost like I felt the effects of the cold more because I had none of the numbing of being in the cold water. So I don't know if you've done much research or thought or had questions around cryotherapy, but if you have, what would you say about comparing the benefits of cold water therapy versus cryotherapy?
So the thing about cryotherapy is that's done in air, basically. It's cold
Right,
air.
right.
Air has what's called a very low specific heat capacity. It doesn't contain much heat. So
Okay.
that's why it has to be so cold when you go into a cryo chamber
Sure.
to actually take heat away from the body.
Okay.
Whereas water has a really high specific heat capacity, which means it just
Zaps
gets
it.
that heat out from you straight away.
Right.
And as I said, one of the key things is how quickly you cool, and that's due to the physical properties of water compared to air. And that's why, if you put your hand in an oven, 100 degrees centigrade, 212 Fahrenheit,
Right.
it's nothing.
Right.
Whereas if you put you wouldn't put your hand in boiling water because
That's
it
a
would destroy it.
That's a great
So,
analogy.
so that's the thing. So I've never done it. My suspicion is, and what your experience kind of confirms this, is you
Yeah.
don't really cool quite as quickly.
Yeah.
and it isn't the all immersing effect.
Right.
So I think a bit like cold showers, it doesn't kind of quite do it the same as immersion. And of course, the other thing is another point you made. It's not quite as accessible. You have to find a chamber.
Yeah.
And one of the things that I always like to bring up about cold plunging is, if particularly got somewhere outside, it's more than just the cold. I mean, great. If you've just got a cold, you just got an ice bath, you just got a plunge thing, great. Use it, it'll have an effect.
Yeah.
But what we found, particularly with our research and my own experience, is that it's not just that. It's being out in nature. We know that's good for you. It's blue therapy, views of the sea or open water. We know that's good for you. It's social.
Yeah, doing it with a group.
Do it with other people. I mean, you
suffer
talked about
together.
your friend, but you've got to do it.
Right.
And you have a laugh. It's this shared, this bonding. This fact that you're doing something crazy,
right,
brings you closer together and enhances that social effect. So it's a whole package of benefits. So it's a whole other thing, cold water swimming, compared to going into a cryo chamber, or even just having, or even having a pot in the back garden.
Yeah.
But great, if that's what you can do. If there's nothing else I could do, I would do that. Don't get me wrong.
Right.
But even then, you're outside, aren't you, in the back garden?
Right. I don't know. We're just talking about that and people and the social aspect of it. And it made me think, I'm wondering, have you ever done this with teens? Because I'm thinking about everything teens are going through, how much more plugged in they are to technology, how much more comparison there is with social media, the social pressures and strains, how much more anxiety and depression our teens are facing, wanting a sense of belonging. I'm thinking first of all, my question is there an age that's too young to be in cold therapy, like from a healthy perspective? And if not, like if it's appropriate for teens, like it would be so cool to like have some kind of group that's giving back to teens in some way. So maybe somebody that's listening is already doing some kind of outreach to teens, and think about incorporating in once a week, especially in the winter months, getting these teens into cold water therapy. I don't know. That's not on my questions here. It's just something that occurred to me. I have a preteen. She's 12 years old, and just knowing all the things that, her friends go through, she goes through, and that it's only going to amplify as they get, into high school. I'm always trying to think of ways to amplify her overall health and well-being. So I don't know. What are your thoughts on that? On this, being an opportunity for teens?
So I have done some research on this.
Okay.
And so for a start, I'm not sure how old you have to be. I mean, certainly my son probably started when he was about 6 or 7, a bit more difficult. He still goes in occasionally with his friends, and that was my youngest son. So the reason we persuaded him to go in was because we said you can have more screen time. You don't get any screen time on a Sunday.
Oh, that's smart. I like that. Yeah.
So anyway, he's fine. Again, don't stay in too long. That's the key thing. Because you don't want him to get cold and become hypothermic, because that's just unpleasant.
Right.
Get him in, get him exposed to it. That's great. But coming on to sort of more that's the age when can you start, and pretty much if you're careful and sensible, pretty much any time. But start in the summer. This is a good rule anyway. Start when it's warm rather than in the middle of winter.
Hey, I hope you're enjoying today's podcast. I just wanted to take a quick break because if you're listening, you probably know what we do here at Invigor Medical Podcast, but maybe not what we do at invigormedical.com. So let me introduce us. At Invigor, we provide prescription strength treatments and peptides for weight loss, sexual health, and lifestyle optimization. Every treatment plan is carefully prescribed by licensed doctors and sourced from legitimate pharmacies. You don't ever need to buy questionable research chemicals again. And bonus, as a podcast listener, you get a 10% discount on your first treatment plan with code podcast10 at invigormedical.com. Now, let's get back to today's episode.
Well, and then that made me think have you ever heard of Dutch baby sleeping?
Dutch baby.
Dutch baby sleeping. Okay, it's strange. Like my sister and my niece turned me onto this, and how oftentimes the Dutch, or at least historically, like would literally put their babies out in their strollers in the outside in the frigid temps for their naps, like completely bundled up, like with a hot water bottle, just their face exposed for their naps. And at nighttime, open the window and get the room incredibly cold and get them all swaddled up with their bottles, and then close the window and trap in the cold air for them to sleep. And it's like the Dutch baby way of sleeping. And I started doing this with my son, who's 8, who's been struggling with sleeping. And I noticed every time he woke up, he was just like sweaty, but he wants the blankets. And I started just opening his window, and like he started sleeping way better. So, and that just popped into my head too. I'm getting lots of errant thoughts here.
Well, maybe I was a Dutch baby. My mum tells me when I was a baby, I had to get outside. If I didn't get outside, and then some days in the snow, she would have to put me. She didn't know what the neighbours thought, but the only way to get me happy was to put me on the front porch, out in the open air, in my pram, and then I'd be content.
I love it. I love it. There's definitely
anyway, so
some
going back to teens.
Yeah.
So what we did, so I did this. So I was talking about these courses I've been running.
Mm-hmm.
So we ran that as a research study as well. And what we did is we looked at teenage mood. So it's not looking at mental health.
Okay.
What you do is you measure. You got this measure called the profile of mood states.
Okay.
You measure it before and after a swim.
Okay.
And there's this, the headline figure is total mood disturbance. And what we found with, I think it's about 40 or 50 of them, the total mood disturbance, it improved. Their mood improved.
Okay.
And they also said probably around 80+% said they would want to do it again. And university said that the feedback was they want to do it with their friends.
Oh, fun.
The social thing. So it appears that if you do it with their friends, if you set up something where they get to do it with their mates, then they will do it, and they like doing it.
Well, I mean, that makes sense. I mean, the book that I've been reading on adolescent psychology, is talking about what an important phase it is of adolescence to grow this attachment to friends. It's part of like separating from the parents and seeking independence. But in the interim, there's a lot of dependence on the social connections that they build. But just saying total mood disturbance, I think anybody that's parented a teen that hears about anything that can improve mood is like, sign my teen up for that, please. But, thinking about Dutch babies, and I know there's some other, historical examples in certain countries of, sending the preschoolers out to play in the frigid temperatures at school. Like it's just a normal thing to have this exposure to the cold, and it's not really something that we're as familiar with, in our westernized culture. But can you speak to that at all? Is this something that's like, brand new, all of a sudden we've got this idea for cold therapy, because somebody one day, Wim Hof maybe, got in the water and was like, this feels great, we should all do this? Or is there actual, history behind doing these kind of cold therapies and the benefits for the body and the brain?
There's a massive history of it. Historically, there's thousands of years of this. Talking about the stuff with the teens, I think there's a really interesting book. So where I come from in the UK, Brighton, it started out as a small fishing village, but then because of what's called the sea cure, which was people coming down to go in the sea and to bathe. Going back, you go back to Hippocrates, to Galen. Hippocrates is right on airs and places. It's all in ancient history, but it's always been recognised. I think what happened was, so the sea bathing thing happened for certainly in the UK for many years, for hundreds of years afterwards. But the pharmaceutical industry started doing great things in the middle of the last century, and at that point we kind of forgot about the other things. I couldn't do my job as an anesthesiologist without
of course
drugs.
Right.
They're fantastic. We forgot the other things like the cold bathing, like going in nature, like being in the sanatorium, the TB sanatoriums, all fresh air, top of a hill, things like this. they're actually all really good things, but we've kind of forgotten about them.
Right. I've talked about this many times on our podcast where it's like, all of the science and the progress that we've made medically and scientifically is all incredible and it's done so many good things. But, especially in westernized culture, in pursuit of that, we've left behind so many ancient wisdoms. So I love that we're starting to bring back to the forefront. No, these are things that have been going on for thousands of years with benefits. And now the cool thing is now we can take these ancient wisdoms and with science understand more about why they're impactful and why they're important. So I think that's so cool. And so we're already taking up so much time, but I do want to make sure, because whenever people ask me about, well, why cold therapy? Like, why should I do this? Let's go through some of what the benefits are. We've already talked about it a little bit. You've mentioned some of the things, but I mean, there's so many that I've heard about that come to mind that I want to ask about, right? And one thing that I've heard about is in regards to fat, two kinds, like one of being the effect on brown fat cells or adipose tissue, and the other on visceral fat. Do you know anything about that, or can you speak to it?
Yes, but I'm afraid I'm going to be a bit disappointing on this one.
Okay. Hit me.
So yeah, brown fat, good fat. And it is good fat. There's no doubt about it. It takes, in fact, it clears fat from the bloodstream.
Mm-hmm.
It converts it, and it's converted into heat energy.
Okay.
So that's great. And you do find with cold adaptation, even in adults, I mean, it's mainly a thing in kids, and it can be or in babies particularly, but it can be a really important source of heat, keeping babies warm.
Mm-hmm.
But you do see with adaptation, you get more fat in adults.
Okay.
However, the issue is that you produce so little of it.
Gotcha.
And it's probably the calorific output of it is probably less than 100 calories a day.
Oh, wow.
So nearly nothing. It clears, the figure is about 0.35% of fat from the body, even in the adapted person.
Okay.
So it is a thing. However, it doesn't have what I would call a clinically significant effect. There was I did have one comment about someone commenting about the brown fat, and she said, well, I've been cold water swimming for 2 years. Why am I still fat?
Right. It's not a cure. It's not like a magic pill to make you not fat
well, that's
anymore.
why.
Right.
With visceral fat, I don't know really.
Okay.
To be honest, I don't know. I mean, I think as with anything, doing anything healthy like this, getting your body out. I mean, we know that any exercise at all is effective.
Mm-hmm.
Any increase in exercise, walking up 2 flights of stairs is enough to have a measurable effect on your cardiovascular health.
Yeah.
So it's nothing. And so just sort of getting out, walking down to the water, getting in, getting out, walking back to the car. You know what? You're doing something good at that point.
Mm-hmm.
And it's exactly the kind of thing that's likely to reduce your visceral fat.
Yeah, totally.
However, I don't know of any research that has looked specifically at the visceral fat.
Right. Okay, another question something that I've heard before, I'm like pulling up my own notes here, was something about like you actually can burn calories with the effort your body takes to reheat itself, right? So, but that kind of leads into another question that I have, because one thing I've always wondered is, because I know a lot of people that will cold plunge or whatever and then immediately get in the hot tub or get in a hot shower to warm up. So I'm wondering, are the benefits of the cold water diminished at all by immediately using hot water to warm yourself up? Or is maximum benefit to let your body do the work to warm itself back up on its own?
So there are a couple of questions in there. Mm-hmm. So yes, the effort of warming up afterwards does take energy. I'm not sure, again, if that's clinically significant amount of energy, but it definitely does take energy, and it gets the body working. So it's a good thing. However, you don't want to get too cold. So you use most energy up when you're shivering.
Yes.
And actually, you can be hypothermic. You can shiver without being hypothermic. I did this a few years ago, this 10-mile swim in 13.5 degrees centigrade water.
Wow. Woo.
And, I was fine. My body was working, and after I was shivering so much. However, what I'd done is I'd taken a temperature capsule. I'd swallowed a temperature capsule so I could see what my core body temperature was.
Oh,
And it
interesting.
was still totally normal.
Wow.
So, but it's unpleasant. So, so for me, I don't like shivering. So over the years, I've worked out how long I need to be in so I don't shiver.
Yeah.
My body just tells me, get out now. You won't be shivering. Stay in a bit longer. You will be. And it's not bad, but it's all right for you.
Right.
As long as you don't become become hypothermic. And this is one of the key points. You don't have to be in the water that long to get most of the effects.
Right.
Just 2 or 3 minutes, you just go in, that initial shock you get. So you get that, you get over that. Your breathing comes back under control. You can look around, enjoy the scenery. That's going to give you the majority of the effect without the shivering and all that kind of stuff afterwards. But that does, the body does use energy to reheat, but as to whether it's going to help you lose weight, don't know, but it might well help you, just the body moving. It's just getting stuff going around the body. Now, another thing is, about the heating up before and afterwards, always best to go into water warm.
Okay.
So if you can go from a sauna into the water, you're totally warm through. Because basically that's your heat storage facility.
Okay.
You don't want to become hypothermic. So if your body is absolutely, totally full of heat, you've got more to give up before you yourself become hypothermic. And it appears that it's just a matter of that exposure to the cold.
Okay.
It doesn't matter. That's the thing. And how you warm up, you're not be using as much energy.
Sure.
But if you warm up afterwards in a hot tub, that's fine. But be a bit careful with the shower. I mean, there's this theoretical thing that your body suddenly, your vasæ, all your blood vessels dilate. It's not my experience. I've been doing it for 20 years. Start with it lukewarm. If it's too hot, you might not feel the heat.
Right.
And you might actually damage your skin. But the actual warming up thing isn't an issue in terms of being dangerous. A sauna, again, is great. There's a good and increasing body of evidence that saunas are good for you as well. That heat stress. So what we're talking about is cold stress,
right?
That being good for you,
right?
But heat stress as well from a sauna can be good for the body and can have, certainly regular sauna bathing certainly seems to help with cardiovascular health.
Right.
So that's it. My one caveat is before you go in, what you don't want to do is sort of be in the middle. You're basically best to warm up from the inside out. So through exercise, through muscle use. And that's what your body's doing. When it's shivering, it's just using your muscles to generate heat. If you sort of warm up, you've just been in a warm car, say, but you're a bit cold in the middle and then your core is warm, the body gets a bit confused. You start cooling quicker than
I gotcha.
If you hadn't warmed up at all. So warm from the inside out or be completely warm through like you are with a hot tub or a shower.
Yeah. Well, that's how I'd always kind of done it, is right after a workout is when I'd get in the cold shower or go roll in the snow or jump in the river. And I mean, part of it is like, I'm so hot, I want to cool off. So mentally, it wasn't as much of a struggle to get myself in it, right? Because I'm like, this is going to be great. But then I read, and gosh, I wish I knew where it, so I could be able to cite it. And it was talking specifically to the mental benefits of cold therapy, right? Which I want to dive into with you. We've kind of already talked a little bit about, but was saying that for the maximum benefits mentally, to get in the cold water as close to right after you've woken up as possible, mainly because your body temp is already, it's like at its lowest point during the day. So it takes you more effort to get into it. And so you would feel the effects of mentally of like doing the hard thing, pushing through it. And it was saying something like dopamine being increased by like 80% or something, or like 8 times, something like that, from getting in first thing in the morning. And I talked with a few friends who have played with cold plunging for years. And one of them is a previous leader of mine who has primarily used cold plunging for his mental health, to the point where his wife will tell him, you need to go get in the tub because she can see such a marked difference for him. And so I literally was on a call with him one day probably 8:30 or 9 o'clock, and he gets on the call, and he was so energized, like, and not like crazy caffeine. Like, there was just something about the way he was talking in his face and the way his brain was firing. And I was like, whoa, Scott, what is going on? And he's like, I always do my cold plunges later in the day, but I've started doing them first thing. And he's like, the way I feel is insane, like the impact. So I think that's interesting because you just mentioned being mindful of your body temp and being warm. And the whole point of this was supposed to be, first thing in the morning, your body temp is naturally lower. So I don't know. What do you think when, hearing that and the comparison?
It's difficult to know. I mean, I don't know. I personally prefer, I generally do it early in the day. It keeps me going for the whole day. I just buzz for the whole day. It was great.
Yeah.
But if I go an hour or two later in the morning, even, it feels easier. When the temperature's really cold, it feels easier. I suspect there might be some differences, but in how it affects you. But I think, again, the overall effects are not going to be altered by that. What is great about that first thing in the morning is it just gets you through the day.
Yeah.
You're great for the whole day.
Right.
And that might be something that really helps people.
What's important is you do it, right?
Overall. So it's kind of a short term. I think there might be a short term benefit from doing it first thing in the morning, but I'm not sure, again, if there's anything clinically significant about doing it later in the day. But I'd love to see, maybe I'm wrong. That's not something, I haven't seen that article. So if you ever find it, send it my way.
I'll have to send it your way.
And I'll have a look at it. But
well, and I feel like we're still kind of like early on in a lot of ways in measuring the mental health benefits. I mean, you yourself talking about this study that you're starting, to measure, cold water swimming versus traditional treatments for depression. You don't see a lot of those, right now, but hopefully we're going to see more and more of them because alternative treatments to mental health issues are, I think, can be incredibly powerful, and we want to see more research surrounding those things. Okay, then I was going to ask you, we kind of already touched on this, but I want to emphasize, like, is there a point where, like, it's like, why are you even trying to get the water colder? Like the cold plunge on your back porch that you're like cracking the ice every morning and you're like, oh, I'm so macho because I'm getting in this super cold water. Like, what's the point where it's like, it's not really any better for it to be, minus 20 degrees versus 40 degrees? Like, is there a point, or is like colder better?
Yeah, there is a point. And that point is, might be is somewhere probably about, it would be about 50 Fahrenheit. So
really?
10 degrees centigrade.
Wow.
Below that, I definitely get more of a buzz.
Yeah.
I sort of feel more of an effect when I go into colder water.
Yeah.
But in terms of the benefits, you're not getting any more below that temperature.
Yeah.
And of course, the risk below that temperature is you're more likely to become hypothermic, which, as I've said, is always bad for you. So you've got to be very careful. Again, you don't need to be in very long.
Right. What do you say to kind of the naysayers out there who say things like, cold therapy actually is really damaging to your body and actually can shave years off of your life because of the stress exposure to the body?
I think this whole stress thing is the body needs stress. It needs to be exposed to stress.
Acute stress versus chronic stress.
Hormesis.
Right.
It's just it's the right amount. So the right amount of stress is good for the body. And this is why I'm here going on and on about the fact is it doesn't have to be too cold. It doesn't have to be too long.
Yeah.
So we need that stress. If you work out at the gym, what makes your muscle stronger? It's those micro tears in the muscle, and it's getting them, and and that is what makes us grow stronger.
Yeah.
We overdo it, of course we're going to injure ourselves, and that's bad for you.
Right.
Hypothermia is the same as pulling a muscle at the gym, but cold exposure, that is getting those micro tears. That's building us up and building us back stronger. Right.
No, that makes so much sense to me. So I have a lot of friends I have some more friends now who are doing cold therapy, right? It's still a smaller percentage than the whole group, but one of my friends has a cabin up in the mountains here in Washington, right on the Natchez River. And there's a handful of us that always get in the river anytime we're out there for a weekend. And then the rest of the group is always out there like, you guys are crazy. I could never do this kind of thing. And I always want to be like, well, you never know until you try. And also, it sucks a lot less for me now than it did when I first started, which I think is what you were referring to as cold adaptation. So what would you say to people that are just like, absolutely not, could never be me? Would you say to everyone, you should at least try it because it's that beneficial? Or I don't know, what would you say? What would your advice be?
Yeah, I think to the vast majority of people, I say just try it. There are virtually no medical contraindications to it. I'm reviewing the people coming through for our trial at the moment, and there are very few. I've said no, that's you can't. It's not safe for you to do this.
Right.
The key thing is start. It doesn't have to be that cold. Start in the summer. Start when the water's 68 or below. Yeah, that's the first thing. It will still feel cold. And always you've got to do it 3 times at least, and preferably 5 or 6 times, preferably 6 times. The cold adaptation programs that have been studied, they do it 6 times.
Okay.
But you probably get good adaptation.
I mean, why is that
significant?
significant?
It's right for you after 3 or 4 times.
Okay, that's what I was going to say. Why is that significant instead of just doing it once or twice to do it more times?
Yeah, well, the thing is, the second time's always the worst. The first time, you're all psyched up for it, you do it, and you get out of it.
That's true, because then on the second time, you're like, oh, I remember how much that sucked. So it almost takes a little more.
How much it sucked,
right?
But you're not really set up for it. You're not adapted yet.
Yeah.
And so it's actually worse because you're not so psyched up. It sucked, but I survived it. I was all good. But then the third time, you're beginning to see adaptation. You can do this even in a day. As long as you warm up in between, you can do this over a course of the day. And that's what we did with Sarah on the TV program I was speaking about earlier.
Okay.
We adapted her over the course of the day. Second time, she almost didn't want to go back. And she said, just one more go. And the third time, it's like, I love this.
Oh, my gosh. That's so cool. If you want to experience the benefits of cold water therapy, whether it's you're swimming, you're plunging, you're in the shower, the face, whatever, how often do you need to do it to really experience the benefits? I mean, if you just do it once a week, are you still going to feel the effects? Or is it really important that you're doing it multiple times a week?
Well, I think the answer to that comes from our studies so far, because what we've been doing is taking people into the water once a week.
Okay.
And we have shown, we haven't done the definitive trial yet. We're in the process of doing that. But in everything we've done so far, they're going into the water once a week, and we've shown a clinical effect from that.
Just
it
once
has
a week.
a benefit on depression and anxiety. So once a week is enough. So this is what I say is not too often, once a week, not too cold, anything under 68, and not that long. Just long enough to get your breathing back under control, 2 or 3 minutes, get past that shock. And then I'll say, as a rough and ready rule, 3 minutes, but you're face in 3 times. And again, it's not like face in and out. It's face in, get over the shock, which is just a few seconds. Out, face in, face out. And do that 3 times. Very, very simple. Nothing very much. No longer and harder and colder.
Right. And
enjoy it. Have fun.
Right. The way that you're talking about it makes it so accessible, and that it doesn't, it's like what I always say to my friends is like, you could do anything for 60 seconds, right? Like, seriously, just do it for 60 seconds and see. And my guess is once you're in there for 60 seconds, because really it's like the first 30 to 45 seconds that are really tough, that take that sort of like, oh my God, I'm in a state, this sucks, this hurts. And then it's like you kind of start to feel a little bit numb, and then your heart rate starts to slow down, right? So your breathing starts to get more regular and slow. And then it's like, okay, maybe I can do this. Okay, yeah. And then you're kind of looking around, and then you're starting to notice the sensations in your body. And like I said, I love to use it meditatively to just really focus on my breathing. I love it when we're doing it in the river up in the mountains, because you're so right. Being in nature, it just amplifies it. It's like the world gets smaller. So it's just this right here. I'm surviving in this cold water, but like suddenly everything all around you expands and gets larger. And there's just such a presence in the moment for me that I've experienced. And yeah, that feeling of, especially if like, I remember we were out there at Friendsgiving and, it's a big group of friends doing our Friendsgiving. And I had a few drinks the night before and I wanted to sleep the next morning and we were supposed to go on a hike. And a couple of the guys were like, come on, we're getting in the river. And I was like, I have to do that because I know how I'm going to feel afterwards. And sure enough, I was not hungover. I was ready for that hike. I was bright-eyed and bushy-tailed and raring to go. And it's just crazy. And I think it's why I started to annoy my friends years ago talking about cold therapy, because I'm just like, it feels so good. You have to know how good this feels. Like I feel like once you've done it, you just like want everybody else to know how good this feels. And like, this is free. You could feel this good for free. It's going to cost you 3 minutes of your life and you can feel this much better. So, thank you for taking all of my questions. There were a lot. You've satisfied a lot of my curiosities, and I really appreciate you taking the time to be with us. From Norway, it's like at this point after 9 p.m. for you. So thank you so much for taking the time. And I want to make sure people know where they can find you, where they can find your book, if they want to be involved in your study, if they happen to be at the UK. So list us off on how people can gain more access to you and the work that you're doing.
Okay, so the study is Outside 2 and it's outside2.org.uk, I think. But look for Outside 2 cold water swimming study. You'll find us.
Okay.
So I've got a website, drmarkharper.com.
Okay.
You can look at that. I do occasional bites on Instagram,
Awesome.
which is @thewildswimdoctor.
Okay.
And my book is called Chill, the Cold Water Swim Cure. Available at all the usual outlets. I mean, it is a US publisher, Chronicle Books.
Awesome.
So available widely. And, it gives you, what I do in it is it gives you the physiology, a bit more of the detail of the physiology, things like the physics of water, why it feels wet, for example. And then a sort of outline of how you can do it, doing it 3 times and
right.
the kit you need or the kit that helps and stuff like this. And then I just tell some extraordinary stories, not my stories, people's extraordinary stories of how they found benefit from cold water swimming. So they're really inspirational. In fact, I've recently recorded the audio book.
Oh, fun.
And the engineer, in the day, and the engineer said to me afterwards, God, these stories are so inspirational. I'm going to start cold water swimming.
That's so cool. I love that. I'm definitely going to have to check it out. Before we sign off here, is there any additional or last final thoughts that you want to offer to our listeners?
No, I mean, my final summary of how to do cold water swimming is minimize discomfort, maximize fun.
Oh, I love it. That's such a good way to look at it, because I don't think many people think about it that way. Just immediately retract from the idea of being cold. So that's a great way to put it. Well, thank you so much for taking the time, especially with the time difference in Norway and being later in the day. We greatly appreciate it. I know Derek was so sad to miss this one, and I'm so glad that I was not the one that missed this one, because I've been really looking forward to it. And we will definitely link all of your stuff in the show notes and to your website and the study, so people can make sure to stay connected to you and all the work that you're doing. And thank you for taking the time to share it with us here. It's been a pleasure to have you on.
It's been an absolute pleasure. Really enjoyed it.
Thanks for tuning in to the Invigor Medical Podcast.
If you enjoyed today's episode, you can support us by liking and subscribing.
Your feedback matters, so feel free to share questions or future episode ideas in the comment section.
For more information about our prescription strength treatments for weight loss, ED, and overall wellness, all from qualified doctors and reputable pharmacies, visit us at invigormedical.com. And don't forget to use code PODCAST10 for a 10% discount on your first treatment plan. Until next time, stay well.